Welcome back to another Sci Twins video.
I'm Rhea.
And I'm Maya. This video is all about ear infections, also known as otitis media.
Approximately 3 out of 4 children get an ear infection before their 3rd birthday.
Yep, I had one when I was 2.
Ear infection.
What is otitis media? It is the infection of the middle ear, which is an air-filled space behind the eardrum. Why is it called otitis media instead of ear infection? Well, the root oto means ear, itis means inflammation of, and media means middle. Therefore, otitis media literally means inflammation of the middle ear. Before we dive into otitis media, let's talk about the anatomy of the ear first. The ear can be divided into 3 parts: outer, middle, and inner. The outer ear contains the auricle and the ear canal. The middle ear contains the tympanic membrane, aka the eardrum, which vibrates in response to sound waves. The middle ear also contains ossicles, which are the 3 tiny bones that are attached. They are the malleus or hammer, which is a long handle attached to the eardrum, the incus or anvil, which is the bridge bone between the malleus and the stapes. The stapes or stirrup is the footplace, and fun fact, it's the smallest bone in the body. The inner ear contains the oval window, which connects the middle and inner ear. The inner ear also contains semicircular ducts filled with fluid that are attached to the cochlea and nerves. The ducts send information on balance and head position to the brain. The cochlea is a spiral-shaped organ for hearing. It transforms sound into signals that get sent to the brain. Finally, the auditory tube, aka the eustachian tube, drains fluid from the middle ear into the throat behind the nose. When a doctor looks into your ear, they use an otoscope. Here's an image of a healthy ear and one with an infection. An ear with otitis media looks red, bulging, and there may be clear yellow or even greenish-hued drainage. Let's look into this a little further. Here is a diagram of a healthy ear and another ear with otitis media. As you can see in the healthy ear, there is balanced ear pressure and an open eustachian tube. In an infected ear, there is a buildup of fluid behind the eardrum. High pressure will push the eardrum forward. There is also a closed eustachian tube. The eustachian tube connects the middle ear to the back of the throat. It also controls pressure in the middle ear. Here's another fun fact. Do you ever wonder why your ears pop every time you go in an elevator or fly in an airplane? The hollow space in the middle ear is filled with air. When the air pressure in the middle ear is equal to the air pressure in the ear canal, everything is fine. But when the pressure outside the ear changes by diving in water, going up an elevator, or increasing altitude in an airplane, the pressure in the middle ear has to change too. This means if pressure outside the ear decreases, the middle ear pressure has to increase. This can sometimes be painful if pressure is not equalized. To help equalize pressure, you can try yawning. If yawning doesn't work, you can pinch your nose and blow into it. You will hear your ears pop and the pain should go away. This process increases the pressure in the back of the throat and forces the tubes that are in the back of the throat to open, thus equalizing your pressure. Otitis media is one of the most common infections in young children. Children experience ear pain, especially when lying down, tugging or pulling at an ear, trouble sleeping, crying more than usual, fussiness, trouble hearing or responding to sounds, loss of balance, fever of 100 degrees Fahrenheit or higher, drainage of fluid from the ear, headache, and loss of appetite. Otitis media can also affect adults, but the infection primarily occurs in children. What is the cause of otitis media? It is an infection from viruses or bacteria, which lead to the buildup of fluid behind the eardrum. Not all ear infections can be serious. While most resolve in a few days without any medicine, some bacterial infections require medicine, called antibiotics. After taking medicine, the symptoms should go away in a couple of days. Thanks for watching! If you learned something from this video, please give it a like, subscribe to our channel, and turn on the bell button to get notified every time we post a new video.